Okay. Hi, so I am Janet Diffin and I'm a research fellow based at Queen's University, Belfast. I'm here today to talk about this model of practice implementation that our team's developed to implement a person-centred approach to care assessment and support in palliative care. And I'm talking today on behalf of the team, which is myself, Gail Ewing, who's based at the University of Cambridge, and Professor Gunn Grant, who's based at the University of Manchester. And I was privileged enough to work with these ladies for the past 4.5 years. You'll see our little hashtag says not, so this is really horrible after all the talks about acronyms, but it's a really long name, so unfortunately we've had to use an acronym. And you'll probably hear me say says not about 3 million times in this presentation, but you will know what I'm talking about. It's okay. Okay, so as I said, this is around workers in palliative care, so just wanted to put into a bit of context first before I get stuck into the presentation really. We know that demand for palliative care is increasing across Ireland and the UK. And people, with these life-limiting conditions are living longer and have increasing palliative care needs. So you can imagine then that the demands on family carers is going to grow considerably also in the coming years. We've talked a lot about the impacts on family carers today. And, we know that despite the pride people can feel looking after their loved one and the rewards that they have, that there are those negative impacts, stress, strain, isolation. I'm not going to go over all that again today. Essentially, we know support for carers is vital, and appropriate support and timely support as well. So today I'm going to give an overview of the SESNAT, Care Support Needs Assessment Tool, and I'm going to then tell you about this model for practice implementation that the team has developed. So this is Gunn and Gail. I felt like I needed to acknowledge them officially, so here they are. Gunn and Gail both developed the Care Support Needs Assessment Tool. And their programme started in 2007, and essentially what they realised was, it was widely known that support was really important during caregiving in terms of carers' health and well-being, but it wasn't well known which aspects were most important. So this is what led them to develop this tool. Furthermore, although approaches to assessing patients are often underpinned by theory and research, the same wasn't the case for carers. And you'll see all these documents and things. This is just the UK context, and I'm sure there's loads more I could add here from the Irish context as well. But essentially, there's all these policies, publications, highlighting the importance of supporting family caregivers. But there was really no clear approach, no recommendations. How can people actually do this in practice? So the Care Support Needs Assessment Tool was developed to provide this evidence-based direct measure of care support needs, which was straightforward to use in practice. And that's really important because there are tools out there, they're too lengthy, practitioners don't have time to use them. So we needed something that was actually going to be able to be used in everyday practice. So what did they do? They carried out 2 studies. So the first asked carers to tell them what was sort of the key aspects of support for them, and I'll pop up the key areas that come up so you can have a read through just while I carry on talking through this slide. So the first study was a large group of bereaved carers, and they did some focus groups and developed these sort of 14 broad areas or domains, which we tend to refer to them as for carers. And then in the second study, they took these 14 key areas and developed them into the Care Support Needs Assessment Tool, and surveyed over 200 carers using the SESNAT, which showed all these questions were appropriate and relevant. And usually when we show these to people, there are no shocks here, no big surprises. When we show them to practitioners and carers and academics and things, they're usually things everybody can relate to. So they fell into 2 groupings, those that enabled the carers to care and those around direct support for themselves as well. So to show you then what the SESNAT looks like, so it's really simple. It lists each of those 14 broad areas, and the carer can indicate if they need a little bit more support, quite a bit, much more, very much more, or no support at all in that area. And the really important thing is that this isn't like just one question. This is an overarching heading for a range of support needs, and I'll come on to that a bit more in the next slide. So the practitioner will go through this but find out what exactly it is in relation to that area. So I'll come on to that, as I said, in the next slide. But essentially then the carer can sort of reflect on what their needs are and prioritise as well, what are, you know, those what are most important at that moment in time. And this is really important quote that we have from one of our practitioners. It's about opening up conversations. It's not about ticking boxes. It's what comes out of that. And this is really important because this isn't designed to be a leaflet or a form that's handed out and people complete and then it's filed away and nothing happens with it. This is the start of a process of assessment and support, and it's about obtaining carers' perspectives on what they need at that particular moment in time. So just to highlight just some of the carers' views on the SESNAP, this is around, you know, these are the questions they have in their head, but they probably don't know that until it's all written down. So it helps put them in control, helps them, empowers them actually to ask for support as well. And again, this care reflected on how, you know, somebody will come out to the house, but they'll sort of forget what their needs were or what they were wanting to talk about, and this sort of helped them to structure that conversation. So as I said then, as a tool to be used in practice, it has to be integrated into this person-centred process of assessment and support. It's not a leaflet, it's not just a form. So if I go through each of these stages, which we call the SESNAP approach. So the first stage is just introduction. So if a practitioner visits a family in the home, for example, they can introduce the SESNAP to the carer, and it's really important at this point they know that this is the start of a process of assessment and support. This isn't a one-off thing they're going to do and then nothing's going to happen with it. They really emphasise that it's going to be an opportunity for them to consider what their needs are and that they're really taking the lead in indicating what their needs are. So it's been introduced to the carer, so they then take a little time to reflect on what their needs are, as I showed you in that little slide with the example. So they can think through this and sort of think, right, well, what's the priorities right now? So they've had a little time to think through what their needs are. The next step is this assessment conversation. And this takes place between the practitioner and the carer as well. And essentially this is for the practitioner to then explore, right, what are their support needs in relation to each of those sort of broad areas. And it's really vital this conversation happens because the support needs can vary for different people. We sort of emphasise quite a lot, if they tick, you know, they need more support in one area, that does not automatically mean, oh, I have to refer them to that service, or it's not about that. It's sometimes really simple things that carers want, which I'm sure you'd all have come across in your own work as well. So we had one great example where a practitioner was sort of a bit panicked, going, oh, how are we going to address all these support needs that come up? And the lady just wanted to have a bit of time to sit in her garden and have a cup of tea. She didn't want anything revelation, you know, nothing that was going to take too much time on the practitioner's perspective. It was just to get somebody in so she could sit and have some time in the garden. So then you find out what the support needs are, and then about having this conversation, right, what would actually be helpful for you? So again, it's taking that step back. It's not the practitioner assuming what is needed, it's finding out from the care what would be appropriate for them. And there's loads of different examples. It might be that, you know, family members have offered to help, but they've sort of been reluctant to ask that help. So the practitioner might just sort of encourage them, you know, take up that offer of somebody coming in to sit with your loved one for an hour. So it can be simple things. You know, the practitioner just active listening, providing a bit of reassurance is often enough as well. Of course, they could signpost the care to sources of support, or they could refer the care on as well. So there's different types of supportive input depending on what the needs are. But really, it's important to find out what the carer feels would help them first before highlighting what's available. And we have, you know, examples where somebody will go into the carer's home and give them a big pile of leaflets or something that's just set aside and not looked at again. So it's sort of to try to avoid that situation happening. And then lastly, there's this shared review. So this is really important that the carer knows this will happen. So their needs will be reviewed at a later date. We all know things can change. very quickly, either whether that be the care circumstances or the patient's condition and things. So it's really important that this whole process is reviewed again at a later stage. So together these 5 stages make up what we call the SESNAP approach. And we talk about this being a person-centred approach in the sense that it is this collaborative approach. It's working in partnership with the care, and it's really about the professional taking that step back from being the expert in care and sort of putting the care in control of what they need. So this was just really to give you an idea of all the work that's been done to date. In the SESNAP programme of research, there's been quite a lot done. And I can't possibly go through it all, but to summarise extremely quickly, we know the tool itself is valid and comprehensive. The areas, were developed from carers themselves. We know that using that tool is not sufficient on its own. It has to be integrated into that process of assessment and support. We know now it brings benefits for carers, and it brings benefits for practitioners who use the tool in practice as well. And importantly, we now know what's actually needed to implement this into practice, and that's where my work came in, this national implementation study in 36 sites in England. So that was a really crucial step, because there's really no point in developing these tools and things if they're actually not going to get implemented into practice. So we now have a really thorough understanding of how this can work. And also then training for practice. So as part of the research studies, we were delivering training to practitioners to assist them, to use this tool in practice and to give them the knowledge to use this tool in practice. And since that, we've also, Hospice UK also funded some research, or some workshops, for teams as well. And there's been a few services that we went to directly to provide training to. And essentially this is just to illustrate, when I come on to my next slide, for our model of practice implementation, it has come from all this work. All the research studies and all the training sessions that we've done so far have all fed in to the model that we've developed. And if you see license requests, just putting that up there to show it's being used all over the world. And we have some good collaborations with teams in different countries as well to help make this a success. So this is the sort of overall model, and I'll go through each wee bit in a wee bit more detail. But essentially, as I said, this is informed by all that work that's been done so far. Basically, when we start the early research studies, it would have been maybe a 2-hour training session with practitioners to sort of give them the knowledge to use this approach in practice. This has evolved immensely over time, and in the study I was involved with, we had a full one day workshop. This is because it's not just the individual practitioner that needs sort of training, but we actually need to assist the organisations to sort of plan for how they're going to use this in practice and pilot and train their colleagues, and then sustain this in the longer term. So it's turned into this sort of massive, massive thing. So this model came about. We've developed an online training package, and this has helped inform our online training package that I'll touch on just at the end. But before anybody gets started with wanting to implement the SESNAP approach in practice, it is a change in practice, and that's not easy. So essentially that's why we've developed this model, because we're going to help organisations do this. And this sounds really obvious, but the very first step, make sure that there's management support in place from the outset. We have loads of keen people who would love to implement this into practice, but you really need to get top level support for this to happen. We also talk about this project facilitation team, and what we found, this is much too big for one person to try and do within their organisation. They need to have a team of people around them that's going to help sort of drive this forward. And the online training package that we've developed has modules specifically designed for this team, so they can work through this bit by bit. So essentially their job is to lead everything at the organisational level. And then we have this sort of concept of sub-champions. So this was, if you have an organisation that maybe has day services and maybe a hospice at home team or community teams, you need to get those little champions from within each team to help drive this forward and keep this going. If anybody has experience of implementing something new in practice, they'll probably know why this is can be quite challenging. So just to touch on the first concept, I'm not going to go into loads of detail here, but essentially, what we learned, there is this massive, planning process that has to be done before you try and implement and start getting going with things. And from that, you see getting buy-in from management and practitioners as well. So a common theme throughout each of these components is around engagement with staff, engagement with management, and sort of taking this proactive approach. So this has been incorporated into a module that will help guide that project facilitation team through all the planning activities that we find are really vital to consider before getting started with things. And again, this is really important to do this early work because it can be challenging to implement a new practice. So I have there identifying current practice. So we get services to reflect on that. So what are they doing now? We often get told, we're already doing this. But when you actually get people to sit down and reflect on what they are doing currently, it's maybe not as person-centred as they perhaps first thought. So it's really important to get them reflect on what they're actually doing now. Setting some goals, right, what do we actually want to achieve from this, so they can reflect later if they've actually achieved their goals. And then all this groundwork. And one of the big things of the groundwork is establishing a care record. So a lot of services want to support family carers and demonstrate they're doing that, but they don't have anywhere to record information. They don't have, the carers doesn't have a record, or they're tagged on to the patient record. And it takes quite a bit of time to establish a new records and electronic record systems and things. So that's one of the things that it might sound really obvious, but it takes a lot of time. So it's one of those things we cover. So piloting then, so this is getting the team together and getting everybody, all the practitioners who are going to be using this, and just sitting down and going, right, how can this actually work in our service? And thinking through the practicalities of that, because it's really not a one-size-fits-all approach, and each service needs to find out what way it's going to work for them. So the project facilitation team, we would recommend they do like a little pilot and use this in practice and see how it goes. And really that's to identify, right, what's going to help make this a success and what things is going to be a barrier, and how can we overcome those barriers before we get started with actually using this in practice. And training then, so I mentioned this probably used to be a 2-hour session right at the start, and now it's just one little module in our online training package, so you can see how much this has grown. Again, this is just ensuring practitioners who are going to be using the CESNAT approach know what it is, what its purpose is, that they have a chance to reflect on how they could actually use it in practice. And opportunities for group discussions are hugely important, really important to get people together to discuss this, to discuss if they have any anxieties or worries, because it's implementing something new, it's a new practice, and practitioners do have anxieties and concerns and worries about that, and that's okay, but it's just get those discussions going and see how you're going to overcome any difficulties. So this is the big one, sustain. We know enthusiasm can be really high when people first implement the CESNAT approach, and everybody is really keen at the start, but things can dwindle a few months down the line. So this is really around trying to keep things going. And one of the things is monitoring and reviewing progress. And again, that might sound like an obvious thing to do, but all these things can fall on the back burner. Patients do tend to take priority, and new concepts for carers might fall off the agenda, so it's important to try and keep that going and have ongoing conversations with colleagues and management. And it's all about normalising this new way of working. So in the same way that new initiatives for patients might be incorporated into discussions at multidisciplinary team meetings and things like that, it's important to ensure that those conversations about carers are taking place in those platforms as well. So that's just a few of the things that we sort of recommend in that sort of sustain. So again, this is a module as well. So really it's about holding on to all the benefits and not letting things go sort of downhill. So this is a sort of glimpse of our online training package that we've developed. So you can see there's the 5 modules. So module 1 is that training, so anybody can do that module to learn about the CESNAT approach. Modules 2 to 5 then are designed for that project facilitation team who are going to get things off the ground, and it guides them through step by step really how to get going with this. And we have loads of resources on there, downloadable materials, videos. We've got some lovely audio clips from our care advisor. So it's just a wealth of information within that. But to really summarise the key things, it's about engagement, it's about being really proactive, and it's about planning. And I just want to acknowledge all the funders, because all this work has sort of came from this, all these different research studies and things. So these are just all the funders of those research studies. And Clark Greater Manchester have funded the development of this online training package as well. And I just want to say thank you to all the practitioners and carers, because essentially all their feedback helped us create this model and furthermore create our online training package. And that's me finished. We do have a website, saysnot.org, and you can follow us on Twitter for anybody who's into tweeting. My email's there, and also Gunn and Gail's emails are there as well. Always looking for sort of new collaborations and you know, seeing where this work can go. So if anybody's interested in doing anything else, please get in touch with us.
I've got something here later that I'll talk to you after. It's like, wow.
Thank you. Okay. Thank you very much.
Okay.